Welcome to Doctors on Call. I'm Jenna Miller. Last month, America celebrated National Love Your Pet Day, but most pet owners will tell you that loving your pet is one of the easiest things you can do day in and day out. Studies show that pets provide a variety of health benefits, including reducing the stress hormone cortisol. Pet owners generally have more opportunities to increase their activity levels and help ease a person's anxiety and even depression. So how can we keep these faithful companions around as long as possible? We'll soon find out with our guest, veterinarian Dr. Brandon Weidenhaft.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital, experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Pet health is our topic this evening on Doctors on Call. Please take this opportunity and call 800-337-4788 with your questions. Dr. Brandon Weidenhaft graduated from Kansas State University College of Veterinary Medicine in 2001. Having grown up in western Kansas, Dr. Weidenhaft was excited to return to the area and has been practicing in Hays for the last 12 years. On September 1st, 2012, he opened his own mixed animal practice, Big Creek Veterinary Services. Doctors on Call brings you information which may be useful to you when you see your own physician or veterinarian. Again, that number is 800-337-4788 if you have any questions regarding pet health tonight. Thank you so much for joining us again this season. We will get going with some questions while we wait for those phone calls to come in. First of all, let's talk about how often you suggest a regular wellness check for a person's animal.
Most of the time we do a yearly wellness check. Some pets, they're doing fine. We don't see them quite as frequently, but typically we'll do an annual wellness check and just make sure that the physical exam-wise everything is going well. Most pets don't need vaccinated every year once they hit adulthood, so we may not see them every year just for routine vaccinations. So we try to just hit them annually with just a checkup.
Sure. Let's talk about that with the vaccinations. Is that just your preference, or is that kind of the idea that they don't need vaccinated every year?
Sure. So most of the vaccine companies, those vaccines will come out with kind of a set standard on what the vaccine's duration of activity is. And then actually, like city ordinance dictates sometimes how frequently a pet needs to be vaccinated. In Hays, we go by a 3-year vaccine, and we use every 3 years as a current. But there are communities that require like a rabies vaccination every year, even though that vaccine doesn't wear off in a year's time. So a little bit of preference, a little bit of city ordinance. So
sure.
Yeah.
Now, I hate to bring up a negative part of that, but sometimes you'll hear if a person maybe gets bit or whatnot, and they'll ask right away, do they have
Sure.
their rabies? How important is that, or what's the process?
So it happens with us if it's a bite that's bad enough that requires medical attention, and they go to the emergency room or like a first care clinic. Typically, law enforcement will be called from there, and that's who we have first contact with. Generally, it will be either animal control. We do have animal control in Hays, or law enforcement, and they will just call and verify that that pet is current on the rabies vaccination. The likelihood of a bite leading to transmission of rabies is not high, but as long as that pet is vaccinated, that eliminates some of those concerns. If the pet is of unknown status or is known to be not vaccinated at all, typically we will quarantine those pets. And it's a 10-day quarantine, and we will do it at the clinic, other clinics, or sometimes they'll use like the shelter or someplace like that. So,
Sure.
Yeah.
And if let's say a pet happens to not have been vaccinated and rabies is transmitted, what can a person expect?
Okay, so if the pet turns out to be positive for rabies, they'll go through what's called a post-exposure vaccination, and I believe it's 3 injections. It used to be you hear about the 18 shots in the stomach, that sort of thing. It's not nearly that significant anymore. I do believe they use the arm. And I think it's a series of 3 vaccinations, kind of a post-exposure prophylactic. So
Sure.
yeah, so
Okay. And how can let's talk about prevention.
Sure.
If maybe a pet is showing some signs of aggression, what can a pet owner do?
well, there's a few different routes to take. A lot of it would be behavior modification, whether it be through trying to refocus their aggressive tendencies by doing an activity, or performing exercise or something like that. So behavior modification is one step, and it depends on the situation. It depends on when the pet is aggressive. Like if the pet just gets aggressive, like whenever strangers come to the house, then there are things we can do to eliminate that anxiety that the pet experiences by, whether it's kenneling them or moving them into like a spare room or something while we know that there's going to be guests coming to the house, to just eliminate the proximity of other people and that sort of thing. It's rare for pets to be aggressive towards their owners. It can happen, but it's not as common as it is for strangers to be on the receiving end of a bite or something like that. And so, we start with behavior modification. There are some medications that can be used sometimes to help alleviate some of the anxiety they may experience. And I guess it's kind of a case-by-case situation, but I mean, there are things that can be done sometimes to help, and sometimes, that pet is just very territorial, and there's maybe not always things that can be done to help.
Sure. Now you mentioned medication. There's also, you see on the market, even essential oils for pets,
Sure,
for calming,
right.
or supplements. How do you
Sure.
feel about those?
Well, I don't have a ton of experience with it. We run into a lot of phone calls about CBD in the last few years, and it's, I hear it'll fix my dog's seizures, and to my knowledge, I haven't spent a ton of time Googling it, but to my knowledge, there's not a lot of firsthand investigative studies that show that CBD does, eliminate seizures or it modifies aggressive behavior. It very well may work for certain pets, and there may be some research out there that I have not come across, but it's by and large kind of a little bit neutral on how much actual clinical study there's been done on it, at least that I've seen. And some of those other things that are like lavender and things like that that help with calming, and we see that it does seem to help. I don't know if it would necessarily be enough with a really territorial aggressive dog, but some of those high anxiety pets and things like that, sometimes those products will help. There's one that's like a lavender scented spray for a dog that just barks a lot, and it has been helpful with getting that pet to stop barking. We had it at the clinic for a while and wasn't a lot of interest in it, so we don't really carry it anymore, but there are things out there for specific situations that seem to help, and those are kind of along that essential oil line, kind of that sort of thing. So, but one thing, not necessarily essential oils, but a lot of those infusers, like Glade plug-ins and things like that, we have actually experienced with the aroma from those actually causing pets to have either vomiting or other issues from that they seem to be sensitive to it. So they, have a keen sense of smell, and they do pick up on like those aromas and things. So it seems to help in places, and other places it seems to cause some problems. So.
Sure. Just
Yeah.
kind of have to case by case.
Sure,
Anyway.
yeah.
Now you mentioned anxiety. What about anxiety when a pet needs to visit you or the vet?
Sure.
How can we alleviate that?
So there are medications that we can prescribe, over-the-counter medications, simple things like Benadryl. Sometimes it causes just enough sleepiness that they are a little more easygoing when it comes to visiting us. There are other prescription medications as well that we can try using to help alleviate some of that stress and anxiety going to the clinic. So there are things out there, some work, some don't. Some of those medications, one will work great for one dog and won't work at all for the other. And then the one that didn't work for the one may work great for the other. So sometimes it's a little trial and error to find the one that works for the pet the best.
Sure.
And so,
Do you encourage, I've heard of some vets saying, just bring your pet in, we'll give them a treat, and then off you go.
oh, absolutely.
So,
Yeah, come in, like jump on the scale, see what they're weighing this week or this month, and get a treat, and hang out for just a few seconds and let them know that it's not always about getting a shot or getting your temperature taken, and we can come in and have a good trip, and then right back out the door. And we do that quite often, especially with puppies that are getting socialized. A lot of people will stop by for just a few minutes, and we don't really do anything but visit for a minute and say hi and bye, and so it's a good tool for socialization of the younger dogs and stuff. But yeah, we always are welcome for people to just practice and get their pet used to us. So it's not a problem.
great. All right, you mentioned puppies, so let's talk about those younger animals and great ways, besides what you just mentioned, to get them socialized and so we don't have problems in the future.
We'd like to do that, and there's, getting them out and let them meet other dogs or going to a puppy training class. In Hayes, we have Hayes Rec, they put on a puppy training class. It gives them an opportunity to be around other pets. The more they're around them, the more adjusted they will be, and help eliminate some of that fear. Some of those little dogs come in and they're just so scared. They wet on the floor and things, and so just those social activities will help alleviate some of their anxiety and help get them past some of those problems.
Sure. And do you find that if let's say they take their puppy or their new animal to somewhere and they've been very anxious, some might think, oh, I'm never doing that again.
Right.
So they need to do the opposite.
Sure, right. More practice makes a better experience. So one of the things that I encourage people not to do is overstimulate them the first few times. Just a few minutes. If there's a lot of dogs at the dog park, maybe go on home and come back later when there's just a few. Things like that to help slowly introduce them to changes instead of all dramatically at once. And that goes with when you get a new puppy. A lot of times we'll get that phone call, well, we've had it for 3 days and it's not eating very good, or it's got loose stools, and a lot of that is just it's stressed out from the changes that it's experienced in the last few days, and it just takes time.
Sure, absolutely. Let's shift and talk a little bit about, you mentioned they're not eating well, or they have loose stools. How do you find the right kind of food? There's so many kinds out there. You've got your more natural kinds.
Sure, absolutely.
How do we decide on that?
From a veterinary standpoint, from my perspective anyway, I like to stick with known companies that have put the research into their products, and I don't specifically endorse one or the other. But what I mean by a known company that has put the research in, you can look at like Hill's Science Diet. It's based right here in Topeka, Kansas. They do a lot of research on their products, and the same goes for like Purina, Iams and Eukanuba. Those are all brand names that put a lot of scientific study into their foods. They do feeding trials. They see how it responds to pets. And so I try to encourage people to stick with the better known brands. You're right, there's all kinds of stuff, and I follow a Facebook page, and it's all veterinarians, and you will see veterinarians on there that you never feed a food that's got a color in the name, and you never feed a food that has somebody else's name in the name. And so I imagine you probably know what I'm talking about there a little bit, but that's kind of the veterinary's perspective on it is stick with a known brand, stick with a company that does research and does feeding trials, and that way kind of what you're getting in the end.
Sure. And if a person takes the time to actually read the label, what
Sure.
kind of ingredients should they stay away from?
Well, a lot of that's a tough question to answer. I'm sorry, because some pets will do great on a kind of a poor quality food that maybe has a lot of fillers in it, and other pets will do terrible on it, and it just depends on the pet and how well they handle it and that sort of thing. Some people are like, well, I'm grain free. Well, that's not necessarily how pets evolved. I mean, to be grain free, they're not necessarily, my dog's a carnivore. Well, yes, if they eat the rabbit, they eat all the rabbit. And so you take a rabbit that's an herbivore, it eats plants, and they'll eat the intestines and things like that. So they are taking in, if it's a wolf or a coyote or something, they're taking in some vegetable or plant-based material as well. So to say that, just being, a meat-based diet, it may not be, perfectly fitting for a pet. Same with cats, so yes, they can get along fine on just a meat-based diet. The big thing that I hear a lot lately is we want to feed a raw diet. And, when you get into raw materials, you can run the risk of running into pathogens, bacteria, and things that are in those uncooked products. And so, I still encourage people to stick with a good quality food that's been researched and it's had the feeding trials done on it. When you start feeding kind of your homemade cooked meals and things like that, sometimes you might fall short in some nutritional areas, whether it might be vitamins or minerals or something like that. So a good quality food has all of that added in, so you're not going to be missing anything.
Sure.
I'm a big fan of sticking with a good food.
So we're talking a little bit about food. How does a person know how much they need to feed their pet?
Okay, so going back to the feeding a good quality food, most all of those feeds will have a feeding guideline on them. And so if you have a 100-pound dog, it might say to feed 2 cups twice a day. And that's a great place to start. And then look at your pet after 30 days. Are we gaining weight? Are we losing weight? Are we at a healthy weight? How's your pet doing? Maybe we need to adjust it up. Maybe we need to adjust it down. Lifestyle, life stages both make a big difference on individual pets. If I had to say, I would say I see more pets that are overweight than underweight. And sometimes people get used to seeing pets that are a little bit overweight. And when they see one that's fit and healthy, they think that dog's skinny. And so, really, I tell people to, look at your pet and see how they're doing and adjust accordingly.
Sure. And how do you, when you were talking about the raw food as well, how do you feel about table scraps?
So I'm guilty of feeding table scraps to our little house dogs. And so I would, in moderation a little bit. My little dogs love popcorn. And so the other night we were watching a ball game, made a popper full of popcorn, and they were eating it as fast as I was. And so, there are healthy snacks. I would encourage people to stay away from processed meats, things like hot dogs. If your pet is on an antibiotic and you break off a little corner of hot dog and stick it in there, that's okay for a week or two. But by and large, those processed meats and stuff have a lot of additives in them and stuff that are not necessarily healthy for your pet. And so, in moderation, a little bit is fine. Vegetables are very good. Most vegetables are safe. We try to stay away from onion and garlic because they can cause anemic problems. Raisins are, some reason or another, raisins and grapes can be toxic, causes problems with kidneys. And it's a weird thing because you can feed a whole bunch of grapes to one dog and it'll never have a problem, and another dog eats 3 or 4 grapes and it's sick. So it's not fully understood why and how come some are susceptible. But like carrot and green bean and pea and those kinds of vegetables are very safe and are healthy, to some extent for your pets as a treat. If you wanted to feed some table scraps and you had some leftover green bean or something like that, that would be fine.
Okay. How do you feel about some owners will just leave the food out? They'll do full feed all day and they can just come and go as they like.
Some pets do great that way. Other pets would eat the bowl empty and be ready for more. So once again goes back to kind of how the pet's behavior is. A couple of my dogs would be fine doing that. My Weimaraner would eat 25 pounds, all at once. So I have both extremes at my own house. So.
Okay, so you got to know your pet.
Right,
okay.
yep.
Now, how essential are dental cleanings?
It depends. A mild dental disease, probably not that important to get to right away. Some pets have a lot of tartar buildup and calculus, and and those can start seeding bacteria into the bloodstream through kind of the root system of the tooth, and those can lead to septicemia problems and things like that, and those are important to get clean. So, you know, whenever I do an examination, I always check the teeth, and if I see an issue that could be creeping up, I will point it out and say, you know, maybe we could be thinking about cleaning the teeth. And at times, I'm like, we probably ought to do that real soon, and you know, antibiotics and things like that, because we know when we start removing that stuff, we're going to be releasing some bacteria. So
Sure.
it depends on the pet. We try to check the teeth. You know, every time we're doing an examination, I'll pull up the lips and check real quick and that sort of thing.
Sure. Now, do you encourage pet owners to actually brush their dog's teeth at home?
Yep, we have some good clients that will come in and pick up, we have a poultry flavored toothpaste, and I mean, we see a lot of clients that will do it. I would encourage it. If you ask me, do you brush your own pet's teeth? I'm not very reliable about it, but I'm not gonna lie, I'm not great at it. So, but yeah, we have clients, and if people want to get started on that, it will help cut down future problems for sure.
Sure. And is there any risks involved in, I'm not sure how often some people have to come in to get their, do a dental cleaning by you, but are there any risks of, you know, putting the dog basically to sleep for a little while to do it? Does it get to a point that it's not safe anymore?
You know, there's always risk anytime you're dealing with anesthesia, and we do have to use anesthesia on them. They just aren't going to you know, allow you to work in their mouths without. There's always some risk. We try to minimize it with monitoring and that sort of thing. And, you know, knock on wood, we don't run into many problems, but there's always some risk. And as the pet gets older, you know, at times we have to look at the situation and determine whether do the risks outweigh the benefits, or do the benefits outweigh the risks, and you know, make a decision there on how we proceed. So.
Sure. Okay. Well, we're going to go to the phone lines. We've got Daniel Lee on the line who's ready to ask a question. Go ahead with your question, Daniel Lee.
Hi, this is Daniel. Yeah, I got my pups. This is about the only time I ever seen this, but they got no hair from their about middle of their hip back to their tail, and it's either coming out or they're chewing it out. I don't know what the deal is.
Okay, and you said they're kittens?
No, these are dogs.
Dogs, okay. So a couple things that would cause them to chew their hair out or scratch their hair out. One would be fleas, and that can cause flea bite dermatitis. The saliva in the flea causes...
flea dermatitis.
I'm sorry, I didn't hear you.
I said flea dermatitis.
Sure, that could be a cause. Another cause could be just an allergen, whether it would be something in their environment, grass, weeds, cedar trees, something in their environment when they go outside.
Oh, yeah, that's what I figured, because they get it every fall of the year to get this. I don't know why.
Okay, so if it happens at the same time every year, it's probably some form of allergen, and it could be from some of the plants going to seed before they go dormant in the winter, and it could be from...
I see.
Yeah, and it could be from, you know, like cedar trees, or it could be from something. But if it happens at the same time of year every year, I'm going to guess it's got something to do with the environment, and it's got something to do with an allergen in that environment, and it happens during a certain type of year. And it could be even things that you don't even realize, because you might live in town, but, you know, like milo dust and stuff, in the fall when they're cutting fields and stuff, that dust will drift, and it could affect your pets, and you don't even realize it because you don't live in the country.
Yeah, because I live right straight across from an elevator.
Okay, so it very well is probably an environmental dust or something that during the fall when the trucks are coming in and unloading. So, you know, there's medications and stuff that might very well help them in the fall, and it would be something that you might have to do for a few months to help them through that period of time. And then in the spring and summer, you don't need anything.
Like an allergen?
right? There's allergy medications, there's pills and injectables that help tremendously. There's also some like even over-the-counter stuff that might help them along, like Zyrtec or Benadryl. It just kind of depends on the situation. But when you say you live by the elevator and it happens in the fall, I'm going to guess it's something in the environment that they're exposed to that causes them to get itchy and start
Yes, sir.
chewing themselves.
That's about the way it happens, you know. And
Right. Okay.
So
Thank you so much, Daniel, for your question. And thank you to Dr. Weidenhaft for being our guest tonight on Doctors on Call. Our next week's topic is gastroenterology. You can email us questions at shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.